1. You are live.
Hello, everyone. Welcome back to Tuesday Tips. Thank you so much for your weekly support regarding Tuesday Tips and our discussion of different topics. We go over different topics in plastic surgery, and I get to answer your questions. Today, we're going to be talking about the gems of recovery. So, I've been having a lot of questions regarding post op. So I decided to do what are the most important things to consider in your post-op, not specific to any procedure, more in general. But of course, if you have questions about a specific procedure, and depending on the area that I'm going to discuss, I'll tell you a little bit if it's one or the other. But this topic is more in general if you're coming over for surgery, plastic surgery procedure. So the first one, if you see here, is the most important one. You do need a caretaker. I can't stress the importance of you need someone helping you out. This cannot be done alone. And when I say alone, you may choose to have a nurse or a recovery system that helps you, and that's fine. I have a lot of patients that travel and then stay in a recovery home, but you have to be okay traveling alone if that's the choice that you're getting. So I always recommend having a caretaker with you, even if you choose to have a nurse for your post-op, just because the traveling arrangements, especially if you're traveling, you'll need help to carry your bags, to help you move around. If you feel a little bit dizzy or lightheaded, you need someone there with you. So I think a caretaker is extremely, extremely important. And a caretaker that you have good relationship with. This person is gonna see you naked, okay? You're gonna need help showering the first time. You may have drains. You may be a little woozy or dizzy when the first time you go in the shower. All of this can happen, and it's pretty normal after surgery. So you need someone that you have a good relationship with and you feel comfortable in the nitty-gritty, which is showering, changing you, putting your faja on, okay? So if sometimes I say, oh yeah, a cousin that lives in Miami is gonna be helping me out. Do you have a good relationship with that cousin? Because that cousin is gonna get up front of everything, okay? So someone that you feel comfortable with, that it's not afraid of blood, because this person is gonna see drains, is gonna see leakage, and the leakage has blood in it, so it looks red. So it's someone that it doesn't have to be a medical provider, but it has to be someone that's okay helping you with the things that you're gonna need help with, okay? Changing dressings, putting faja, showering, food, moving you around, helping you get up and walk, all of this, okay? So this is number one, the most important, okay? Let's talk about massages. The massages are a key component of any plastic surgery procedure, especially liposuction, but any body contouring procedure like a tummy tuck, body lift, anything like this. When we're doing this type of procedure for liposuction, we empty the fat and the skin needs to attach back to the muscle and heal an empty space. This space is going to fill up with fluid, and your lymphatic system, it's going to be disrupted with inflammation, trauma from the surgery, cutting if it's a tummy tuck, body lift, back lift, cutting the lymphatic system, and fluid is going to accumulate. If we don't do anything with this, one, it may accumulate and form a seroma, which is fluid buildup underneath and then needs to be drained with a needle. Number two, it can cause areas of more inflammation than others, bumps, lumps that then become permanent over time. So massages are extremely, extremely important. I have a lot of patients asking, can I do them myself? The answer is no. You cannot expect to do your own massages. This is not going like this in your skin. This has a technique, and you need a professional lymphatic drainage specialist doing your massages, okay? You're investing a lot in your surgery. You're going through a lot during the surgery and the post-op. Make sure that you have someone with experience that can help you with this part, okay? The results may be affected if you don't get adequate massages post-op, okay? Can your significant other caretaker do the massages for you? The answer is no, okay? Again, this is not massaging for stress. This has a technique that needs to be done by a professional, okay? How many massages? Very common question. I use my rule of sevens, okay? I recommend around 20 in the entire post-op course. So let's choose 21 divided by 3, and we get 3 sevens. The first set of 7 every day. So the first week you should be getting 1 a day, starts day after surgery. The next 7 every other day. So usually you stay here in Miami for a week. After 1 week you go back home. At that time, usually you can start to do them every other day. After you completed those first 14 massages, 7 plus 7, you have still 7 to be done. So you can do them weekly, every 3 to 4 days, twice a week, depending on the level of inflammation that you have at that point. Again, usually 20, some people need more, okay? Some people that have loose skin, that have fluid accumulation, that have areas that are stubborn with inflammation may need more massages, but usually around 20. And this is for a lipo case, okay? Lipo cases will require more massages because we're doing liposuction around the trunk, okay? Lipo 360, BBL, those type of procedures, and the amount of fluid accumulation and skin retraction needed is more. For a tummy tuck, we're only doing in the waist area, flank area, so you may need around 10 massages in the entire post-op course. So it is a little bit less if you're doing a cutting procedure like a tummy tuck body lift, but this rule is usually an easy way to calculate if you're having lipo 360 BBL surgery, okay? Compression foams boards. A lot of people get so confused, and I understand, right? When I started learning about plastic surgery and all of this, it's like there's so much information. What's a foam? What's a board? What's a faja? What do I need? What faja do I need initially? We are going to provide you with everything that you'll need for the first week. So I don't want you stressing that you came in and you didn't have a faja. The faja that you're going to need, or the binder, if it's a cutting procedure like a tummy tuck or body lift, I'm going to provide for you. So the faja that you're going to need, or the stage 2 or stage 2 after the drains are removed, if it's a cutting procedure, that faja you'll get after usually 5, 7 days, sometimes 2 to 3 weeks if you have drains and they stay longer, okay? So you don't have to rush before getting in buying a faja that you don't, like, most likely it's not gonna fit after your surgery because we're gonna shrink you. So it's gonna be a big one for you. And you don't know the area as well. So it's better to wait. Do not buy garments beforehand, okay? Let's talk about the foams and boards. So this is the foams that we're gonna provide for you here today. These are the foams that we're gonna provide here to in the day of the pre-op, okay? What's a foam? So basically it feels like a foam, something soft. It is meant to protect your skin from the garments. When you put a faja, especially a tight garment, it may create creases, especially around the waist where you're buttoning the seal of the faja, and it can create indentations in the skin. When the skin is so traumatized from the lipo, all of those dents can become permanent. So the foams protect to give you an even compression without those creases of the faja. It's basically a cushion to protect your skin. It also improves the swelling and the bruising because, again, it's giving you even compression and protecting your skin. Where do you put the foams? Basically, a tummy tuck in the areas of liposuction, the waist, okay? It depends on how long your torso is. There's people that have a long torso and they'll need to put it in the long way, but usually with tummy tucks, you're gonna put it sideways, okay? It's gonna go from the bra line area all the way down to basically the end should be on top of the incision where the drain comes out, right there. And that's gonna give you even compression throughout the waist and flank area where the liposuction is, okay? One on each side, and then you're gonna put the binder. For lipo cases, we're gonna give you 3 foams because for lipo, I want compression in the center of the belly as well. So for the center, you're gonna put it this way, right here, below your breast, all the way down, and that gives compression in the mons area too. So you have even compression in the entire front, and then 1 on each side. What's very, very important, that the foams, especially when you put 1 in the center and 1 on the side, you don't leave a gap between the foams, okay? Put the foams right next to each other because if you leave a gap, swelling is gonna develop in that crease, and that crease, one time, don't be scared, it's not gonna become permanent, but over 6 weeks doing this, that line there may become permanent. So don't freak out if you're like, oh my God, I did that one day and I saw it. One day is fine. Just try to do it very closely together so you don't have that line in between, okay? Boards. So boards, for the first week, we're gonna give you the back board. This basically goes over the lower back where the gluteus begins, okay? So butt cheek, right there. Why? Because this triangle in the lower back is the one that accumulates the most swelling, and it takes time, it'll come down, but it usually takes basically the entire drainage of the back and accumulates just right there. So you're gonna put it and you see that it has compression and it's thicker there, so it gives you good compression in the lower back to try to create that silhouette of the lower back to buttock transition. This you're gonna start the next day, as well as the foams, with your stage 1 faja. The stage 1 faja, again, we're gonna give it to you. This is not for tummy tucks, this is not for body lifts, this is for lipo BBL cases, okay? So this one in the back, foams on each side and in the center. So basically you're wrapped around with a board in the back, foams on the sides and in the front, and then your faja, okay? Where and when do you use an ab board? An ab board you can start using, especially if you have some loose skin, after you switch to a stage 2. A stage 2 you switch after a week, okay? And the ab board goes on top of the foam, okay? The ab board is harder than the back board. It is to get you support, so basically when you're moving around during the day, the skin doesn't crease under the faja. It gives you kind of support to have that evenness with the foam and give you that kind of torso support. So even if you're sitting down, you're maintaining that support to get the skin to retract more evenly. So after you switch to stage 2, you may start your ab board, foam first, ab board, and then the faja. So it gets a little complex. You'll get your routine and you'll be able to put all the foams and boards, don't worry, but it is foams first. Always think that the soft thing is to protect your skin. This goes over the skin. The hard stuff over that, okay? Soft directly over your skin, okay? So that's basically the rundown with the compression foams, boards. If you have any questions, we don't expect you to be a master of compression when you come. We know that you're going to have confusion and doubts regarding this. We're going to be with you explaining everything throughout the post-op. So I don't want you stressing about all of these details beforehand, before you come. These videos help you kind of have an understanding, but you'll get the use of it afterwards when you're actually in the post-op course, okay? Let's talk about one of the most important things, gems of recovery. This is like top is your diet and your hydration. And diet starts and hydration start before the surgery, okay? At least 30 days before your surgery, you should be focusing on a healthy, balanced diet, okay? Try to decrease the fats, the unhealthy fats, fried stuff, highly processed foods, all of that, salt, it's gonna get you more swollen and not have a good healthy system to tolerate the trauma of surgery. So you should be focusing on that. And I don't want you dieting the 30 days before surgery. That's not the time to restrict your calories. Why? Because we're gonna need a lot of protein to heal the incisions, to heal the skin, to heal whatever it is that you're having to. So if you're restricting your diet and having a low calorie, low protein diet, that's not going to help you recover. That's actually going to make the recovery worse. So the 30 days before surgery is a key time to concentrate on a healthy balance, but also high protein diet to get your protein. We heal, our system heals with protein, basically. So that's one of the most important things. And the salt is just gonna increase the swelling, which are gonna increase the time that you need massages and compression and all of this, okay? The hydration again starts before the surgery, but that first week after the surgery, your hydration is so important. I recommend at least 1 gallon of fluid a day. That's a lot. Most people don't drink that. So I recommend you start trying to drink that gallon before surgery. So when you are in the post-op period, you're used to it. Your body's used to it, okay? If you start after surgery and you used to drink 1 glass of water a day, you're not gonna be able, and you're gonna be peeing a lot, you're gonna be moving around a lot. So it is better that you get your body used to a gallon of fluid a day, moving that along so you can recover better. And a gallon of fluid includes water, electrolyte drinks, okay? Very common after like lipo BBL, and I see it on basically all surgeries that people concentrate on hydrated and drinking a gallon of fluid and it's a gallon of water, and then they're like, I feel pins and needles in my mouth. I feel pins and needles in my hands and feet. I feel cramps. All of those are signs of low magnesium, low calcium, low potassium. They are electrolytes and we need them for muscle movement and nerve movement. So you need those. So not only water, electrolyte drinks are very important. Gatorade, Pedialyte. Make sure they are 0 sugar or low in sugar because you're going to be drinking a high amount. And if you are drinking beverages with high content of sugar, you're going to be drinking a lot of sugar throughout the day. So I do recommend electrolyte drinks, but make sure that they're low or 0 sugar so you don't go over your sugar daily intake, okay? And the other one that's super important, it's pineapple juice. I know. What does the pineapple have? If you guys have heard about bromelain, which is a common natural supplement to decrease bruising and swelling, that's given after surgery, pineapple has natural bromelain in it. So that is why it is so good for decreasing swelling. It has some sugar, which is going to help you. We need sugar after the surgery. You are not eating as well. You are feeling dizzy, and the sugar is going to help you recover, but it's natural, healthy sugar content. So it's not added sugar or high fructose sugar added to your food. So it is a good sugar base and also bromelain base that can help you decrease swelling. So I always recommend incorporating pineapple into your post-op, okay? For BBLs, remember, focus on the healthy fats. What is that? Yogurt, lactose products, cheese, salmon, nuts, what else? Avocado. So all of those are going to be important to try to keep the healthy fat high content in your body, so we keep as much of the fat cells that we transfer alive and well and maintain your results, okay? Exercise. Maintaining your results long term, this is if you decide to undergo plastic surgery, it is a decision that it will change your lifestyle. If not, you're gonna go back to your initial body and you're gonna lose your results. And that's the reality of it. It's like a diet. If you go on a diet and then end up the diet and start eating the same you were eating before, your bodies go back to that. So it's the same as plastic surgery. Plastic surgery will optimize your shape and your results, but if you go back to your early routines, you're gonna lose the results that you worked so hard for. So I do recommend starting an exercise regimen 6 weeks after surgery. We wanna heal, okay? And depending on the surgery, for example, for BBLs, strength exercises are key. We want to build the muscles of the buttock and also lower extremity to support the fat that we transferred, and that's gonna optimize your results. If it's a mommy makeover or a body lift, even a brachioplasty, I recommend exercises that are stretching exercises. That's going to help with the scarring and that feeling of tightness that we end up having after a tummy tuck muscle repair brachioplasty. So Pilates, yoga are exercises that are very good. Also focusing on core strength. Remember, when I do a tummy tuck, I put the muscles together. But if the muscle is flappy, thin, has no tone, you're still gonna have a bulging in your belly. The muscles can be together, but we need to strengthen those muscles to maintain that flatness and get a good core result. So that's, the surgery is one part, but you need to put in the work to get that belly flat, okay? And most importantly, scar treatment. First 2 weeks, you're not going to be applying any scar products. For the first 2 weeks, you're going to be avoiding tension on the incisions. Scarring worsens with tension and also the time afterwards with sun exposure and added like smoking or added um, toxins to the scar. Okay, so let's start with the first 2 weeks is avoiding tension. Arms, brachioplasty, T-Rex arms. Your elbows are gonna be almost glued to your body, okay? It's okay to have some range of motion. Up to shoulder level is fine, but you shouldn't be lifting your arms away from your body, away up than your shoulder level, okay? That's for 2 weeks. Whenever we move, especially the breast incision stretches and the arm incision stretches. So stretching makes gives the body a signal that they need to send more collagen because we need to close this. It's basically our mechanism to try to avoid the wound opening. So what collagen does is building more scar, making it thicker and harder because we're applying pressure. So that's our body's mechanism to try to avoid it opening up, okay? So decrease tension, tummy hunched over. If you're getting a body lift, you should be hunched over, but you shouldn't pass 90 degrees in your waist because then you'll put tension in the back, okay? If you're doing the thighs, try not to bring your legs apart more than just a few inches, okay? So when you're getting in and out of bed, try to move both of your legs together, small steps, anything avoiding tension on the scars, okay? Super, super important. And at 2 weeks, I recommend starting scar treatments, okay? I recommend Silogen because it's a great product. It's 100% silicone based. So it comes, the form that we have here available is the gel. This one has SPF in it, so I do recommend buying this one for areas that are exposed to the sun, especially the arms. You apply it twice a day, and it's basically a gel. So when you apply it, you can see how it looks, and you just need a little bit of it, and basically massage it over the incision, okay? And this is twice a day. And once you massage it, you can see here that it kind of creates like a thin layer of product, and that's the silicone. So you're gonna leave this until it dries up, okay? We want this to dry up before applying any like clothing or covering it because you're gonna take the product out. Once this is dried up, then you can get dressed and that's it. And that is twice a day. It comes also in a tape form. A lot of people ask me, I've heard about the tapes. What's the difference with the Silogen? It's the same, it's a product type, okay? It's just how it comes. Silogen comes in tape form too. If you're doing Silogen, you don't have to apply the tape on top. This is gonna cover the scar like the tape. The only difference is the tape, you wear it for 23 hours a day. Silogen, you apply it twice a day, and that's it, okay? And the other thing that I was gonna show you guys is the belly button shaper. This one we have here available. It's also a Silogen product, okay? So it's silicone based. This one I like a lot because it's hard enough that it maintains the shape, but it's not as hard as a marble, which can be very hard in your skin and in the scar. And it's also very round and not like a plug. Sometimes the plugs irritate the skin because it has a narrow part and then a wider part, and the wider part just irritates the scar. This one, it's a circle, so you just put it in the belly button at 2 weeks post-op. Sometimes you need to put a tape over so that this doesn't fall down, and then the faja or the binder, depending on where you're at. You should be wearing it for at least 3 months consistently. What's the point of this? Every scar in the body tends to contract. A circular scar, when it contracts, it may close the belly button up, okay? So we want to maintain that shape while the scar is developing and healing. So enough that it not closes down and maintains that circular shape, okay? Okay, I'll take some questions now. I'm full of Silogen now.
Okay. What are your thoughts on awake lipo?
Awake lipo. So I think there is a lot of people that think that's like the holy grail, but I don't like it. I'm going to tell you two big reasons why I don't like awake lipo. One is pain level. I think that even if you do use some type of sedation, you are going to be feeling a lot of it, and not mainly pain, but also movement and pressure. Liposuction is basically inserting a cannula and basically going back and forth like stabbing yourself. So it is a painful procedure, and I think that in order to make it tolerable, we need to add a lot of lidocaine or local anesthetic. When we're adding lidocaine in the amounts that you need for like a Lipo 360 BBL, you end up having toxic levels, or you may end up having toxic levels of lidocaine in your system. The problem with lidocaine is you won't see it right away. Lidocaine toxicity manifests at least 10 to 12 hours after the completion of the administration of the lidocaine. Where are you 10 to 12 hours after I injected that? Probably home already, so I won't be able to monitor you, and you may develop lidocaine toxicity where you are. So I think it's dangerous, and I don't think it's worth it, pain-wise and safety-wise. I think comfort level is better to have you under. I can manage your blood pressure, heart rate much, much better, and your airway when you're under general anesthesia. And I don't put lidocaine in my tumescent to avoid that risk of toxicity when you're back home. What's the lidocaine toxicity? Neurological problems, arrhythmias, heart failure. So I don't think it's worth it.
Okay, what do you recommend using on a scar around the areola? I had a breast lift in 2023 and the scar is red and raised.
In 2023, you're still a good time to start the Silogen, okay? Silogen, massage it twice a day and give it time. The scars tend to mature with time, so they start to get red first raised, and if you apply consistently product, you're not going to see a change right away. It takes 3 to 6 months to see a change, but they continue to mature up to a year, okay? So you're still good to start it.
Is it possible to get a tummy tuck from you if I live out of state?
Of course, very common. I have a lot of patients that travel from out of state. There are a few things that we're going to ask you to keep you safe when traveling over. And one of those is flying with someone or having someone to take care of you while you're here, but completely not a contraindication. I do it every day. So if you are interested, just go to our website and hit the virtual consultation form, fill out the form, and we'll give you a call regarding our recommendations.
Okay, and let's take the last one. The meeting is going to start. And this, I think she's a little bit confused because she asked, why do you only remove 1 liter of fat per surgery?
No, that is not correct. 1 liter of fat removal is with when you're combining liposuction with an open procedure like a tummy tuck. So this is not me. This is the state of Florida. I'm just following the law. Okay. So any office-based surgery in the state of Florida needs to follow these rules. If in another place they're not doing it, that's up to the other place. I follow the law in the state of Florida. So basically, the law states that in an office-based facility, a maximum of 4 liters of fat can be removed when you're doing liposuction only, Lipo 360, BBL, liposuction procedures. And if you're combining liposuction with a procedure, example, a tummy tuck and we're doing lipo to the flanks, a breast dog or a breast lift and we're doing some liposuction, a brachioplasty, we're doing any cutting procedure, the max amount of fat removal with liposuction is 1 liter. Why? Because in an office-based facility, you're going home or a place outside of my care, and it's not safe to be removing that amount of fat and then sending you home. If you're getting more fat removal, I'm not saying it's not doable. Yes, you can, but you should be admitted in a hospital and be monitored for at least 24 to 48 hours afterwards, which is not something I do. Okay, guys, thank you so much for the questions. I hope this kind of helped organize your thoughts regarding the recovery and the post-op care. And remember, if you have any questions, do not hesitate to contact us. Our coordinators are great explaining the process. Our pre-op team is amazing. So don't feel that you are alone or you're not understanding anything. I want you guys to be reaching out so we can guide you in the right track. Thank you so much. I'll see you guys next Tuesday on Tuesday Tips. Take care.